and I am Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. Today we have a very important subject to talk about. It's the subject of diabetes, and which is so prevalent in this country, isn't it? Today we have Barbara Lester, and Barbara, what do you do? You're with Cambridge Health Alliance?
I am a nurse at the Cambridge Health Alliance, and I'm also a certified diabetes educator, which I've been over 15 years.
And that means?
Certified diabetes educator means I took a national exam to be an expert to help patients with diabetes.
Which makes you an expert in the field.
Correct.
Very good. And we have Caitlin Van Riesen. Caitlin, what do you do with the Cambridge Health Alliance?
Hi, yes, so I'm the Clinical Nutrition Manager at Cambridge Health Alliance, and I have been a practicing registered dietitian for over 10 years.
Great. Well, thank you so much for being with us. We really appreciate it because there are so many people that I am involved with and run into that have the disease of diabetes.
That's right.
My own mother and one of my sons. Mm-hmm. So do you want to talk about that? How?
Sure, yes. Today, diabetes is very prevalent. There's 30 million Americans who have a diagnosis of diabetes today.
30 million?
Mm-hmm. Yes, which is 1 out of 11 people will have diabetes.
Well, that's a scary thing.
It is, yes. So it's good to have this program to get the word out there how important it is to get good treatment for your diabetes. So there's 2 types of diabetes. There's type 1 and type 2. So we're mostly going to be focusing on type 2 diabetes, which is very prevalent today. And how you get type 2 diabetes is that it's usually a familial. It's someone in your family has had it, on your mother's side or your father's side. Or some people, like I was just reading, Dr. Phil has it. He's had it for 25 years now, and he has it from both sides of his family.
Wow.
So
he didn't have much of a chance.
No, he was doomed.
But people can get it without having it on either side.
Correct.
True,
Correct.
right?
Yes. With the problem today of obesity and being overweight. So what happens that the pancreas is where the insulin comes from, and your pancreas can be making enough insulin, but sometimes if you have a large weight gain, the body can't use that insulin correctly. So and that's why the body can't just use the insulin into the cells where it belongs. So the food stays in the blood, and the blood sugars get higher. And
so the insulin regulates the blood sugar?
Yes. How insulin works, when we eat food, the pancreas lets out the insulin to match the amount of food that we ate, especially the carbohydrates. And what happens is that the insulin attaches to the food and puts the food inside the cell where we use the food for energy. So when you can be making enough insulin, but the food the food cannot get into the cell because the cell is misshaped from the obesity or whatever. So it just can't be used correctly.
Well, this is very fascinating. I never heard this. Yeah. So insulin is what? Is it a hormone?
It's a hormone.
It's a hormone.
Mm-hmm. Yep.
Wow.
Yep. So the body makes just enough for the amount that we eat. It lets out enough just to get the food into the cell where we use it for energy. So when people if the body's not using the insulin correctly, what happens is that they feel very tired when their blood sugar is high. And what happens is that the food stays in the blood. It's not getting inside the cell. That this thick blood is going to the kidneys, so you're making more urine, so you tend to go to the bathroom a lot more when your blood sugar is high. And so you're tired, and you go into the bathroom a lot, and you're very thirsty because of the blood being so thick. You're getting dehydrated, so you tend to go.
I know that thirst goes along with it, but I wasn't sure why.
Yeah, that's mostly why. Yeah. And then we have type 1 diabetes. Type 1 diabetes is what we used to call the old juvenile diabetes, but we call that type 1 diabetes now. It's mostly seen in the young. Usually adolescent is a common age where it's diagnosed, but I've known people up to ages, older, 40 or 50, couldn't get type 1 as well.
So what would be the difference? I mean, how?
Type 1 is when the pancreas, for some reason, is just not making any insulin at all. Okay. So you need to take insulin by injection.
Starting at that young age.
Yes.
But even if someone is older, say 40 or 50, they can be diagnosed with type 1.
Right, and they would need insulin. They can't take a pill. Like type 2, we usually start people out on, there's 10 different kinds of medications now for diabetes. Yeah, there's many different kinds that work in different areas. a common one that people use is called metformin, or the other name is called glucophage. That's like the first line that usually people are given when they're diagnosed with diabetes. And how metformin works is it works on the liver to help, because the liver puts out sugar too. It's called glycogen. So it works to help the liver not to make as much sugar.
So it holds it back from the liver.
Correct. Yes.
So, and that affects the overall blood sugar.
Correct. Yes. Yes. It helps people lose a little bit of weight as well, which is usually a given for a hopeful if someone's overweight. It kind of helps with their weight management as well a little bit. So, but they're all different kinds, and so how we decide which medicine works best for you when you have type 2 diabetes is kind of like trial and error. We kind of have to see where the problem is. Is it with the liver putting out too much sugar? Is it the pancreas not being able to put out enough insulin?
So there's no test that will tell us that. It's just
Right. We have trial and error. So
so it can be different for everybody.
Correct. So usually metformin is like the first line that we start patients with, and then and there's also the sulfonylureas, which is the glipizide, and glucotrol, which is a very common medicine, and which is old medicine, which is on the cheap side. It doesn't cost as much for patients to be on that as well. So you have to look see what kind of insurance they have as well to see what we're going to be treating with.
There's a lot that factors into it.
Right, and so how glipizide or glucotrol works too is it helps the pancreas put out more insulin. So that works on the pancreas part.
Put out more insulin,
Right.
so then the insulin could get it into the cells.
Into the cells.
cell.
Correct.
Which is another reason why and we'll talk about this with Caitlin, another reason why we want the food that we eat makes all the difference in the world.
Absolutely.
Right? Either we're going to get energy from it, or we're going to eat empty calories and get nothing from it. So we'll talk about that.
Exactly. Yes. So today there are many other medicines that are coming out. You may have seen it on commercials on TV. There's medicines called that work on the gut hormones. An example of that would be like Trulicity or Victoza or Byetta. And so they work on like the gut hormones to help people feel fuller longer. It helps the digestive system slow down. So people tend to feel fuller longer, so they don't eat as much. So it helps in
That
that
could help
area.
with weight loss,
It does. It does help with weight loss.
although it's not a weight loss management.
Exactly. Yeah, they don't.
But
Exactly. That's just a benefit of it.
That's a good side effect.
Exactly. So that's popular, but again, it's expense, which can be very expensive. And then there's insulin. So the doctor may try out different oral medications. There are other ones too that are out. There's GPP4s, which is like Januvia, and there's like 4 different
I've
classes
seen
for
that
that.
advertised.
Yeah, so that has that's a newer one that's out too, but expensive. So we have to really take cost into consideration.
So if they're new, my understanding is then there's no generic because it's still under the patent, so
Right.
it would be top dollar for
Right.
that. Right.
Yeah,
If that's an
metformin
important factor.
Yeah, so metformin and the sulfonylureas, which is the glipizide and glucotrol, are the cheapest ones. They've been around quite a bit.
Right.
And even insulin. So insulin we know comes in a vial and syringe, and there's also the insulin pens. But again, insulin all prices have gone up dramatically in the past few years. It's questioning.
I've heard that.
Yes.
I've heard that. So it's some incredible
Yes.
amount.
Right.
Like hundreds of dollars.
Yes.
Is that
yes,
true?
It is true. Yes. It's
So how do we do that out here?
the pharmaceutical company. It's a hopefully it can be addressed further about this, but it is a problem for people to afford their insulins. But so it's good. I was reading that it's really the vial and syringe is the cheapest way to go. Compared to the pen, but the pen is more convenient for people to take to a restaurant when they're going to eat. They can just take their insulin pen with them, which is much easier for people. But
and also for anyone, if they might have any diabetes or any vision problems, it's like, is it just like dial it and then?
it does. It has a noise as you click it. So it is help with some visual problems. It does help
We
with
can
that.
see that there's a benefit, but everything is case by case. Not everything works for everybody.
Right, exactly. Yes. And so then we get into the so for diabetes over time, so a doctor will draw a hemoglobin A1C, which is a blood test we do every 3 months. what the hemoglobin A1C is that sugar collects on top of the red blood cell, and so they do a test every 3 months, and it just kind of looks at how much sugar is on the one red blood cell.
On the one
Red blood cells.
no,
I'm sorry, not one red, but all the red blood cells. And the red blood cells, the lifespan of a red blood cell is 120 days, which is 3 months. That's why we do this test every 3 months. So, because that's how long a red blood cell will live. So ideally you'd want an A1C under like 6.5 or 7. So to keep the long-term complications of diabetes down, which the long-term complications are can affect the vision, the eyes, and can affect the kidneys, and can affect the feet, the vascular. So
the limbs, people result in amputation.
Correct.
And neuropathy, which is the
nerve endings.
Yes.
Yes.
I call it the great remover if the disease is not managed well.
It is, and what happens is a lot of things are going on silently, even though the patient doesn't have any symptoms, that their blood sugars are high. There is a lot going on inside, a lot of damage being done with the eyes and the kidneys. And why the eyes and kidneys are mostly involved, because they're very fine, the blood vessels are very fine and delicate. And when the blood sugars, especially if the blood sugars are going high and low, if they're like roller coastering, those blood vessels are like bursting. And that's why
So it's better to stay as even as possible rather than to put the pressure on them.
Right. That's why
I wanted to ask you, so what's the normal range of blood sugar?
Here's a good question. So a fasting blood sugar, which is the first thing before you eat in the morning, although some people work the night shift, so it's the longest time going without eating. So we like that between, it used to be 80 to 120, but sometimes we could lower it down to 70 to 110 via fasting blood sugar. And then after you eat, we like anything under like 170 is what we like it to be. So
eating naturally just raises the sugar because you're...
Correct. And generally we ask people to check their blood sugars 2 hours after they eat, because immediately after you eat it will go up, but in 2 hours it should come back down with medication or, just in general if you're just going by diet. So in 2 hours it should come back a normal. We want it under 170.
170.
Correct.
Under 170.
Yeah. So generally I some patients, they've been running in the 300 or 400, so I'm happy with a number under 200 to start with. Depends on where they're beginning with. There's many people walking on the street with blood sugars of 400, 500 and don't even know it until they come to the doctors with a headache and we find out.
Do they get blurred vision or anything?
Yeah, it's amazing. The body will adjust to these high blood sugars. Everyone has their own threshold. So it depends. Some people will feel it more at 300, but people, as I said, people are walking out there with blood sugars of 500 and don't know it till they get really dehydrated and they come to the doctor and for some reason.
I have a friend that wasn't feeling very well. This is years ago, and they took her to the hospital, and she had a blood sugar of 900. 900.
Yeah.
And so they said she could have gone into a diabetic coma.
Yeah.
With the sugar that high.
Yeah, that's very high. And so what's really important is we ask people with diabetes, type 2 diabetes or even type 1 too, to get their eyes checked, as mentioned, the visual problems. So just to see an eye doctor annually, because the eye doctor will do a test. He'll dilate the pupil and look in the retina in the back of the brain. That's where the eye center is. So he'll look there with the machine to make sure the blood vessels look okay. And some people will need to have, if there's some leaking of the blood vessels, will need to have some laser treatment, if they have some problems in that area. And then we do a test every year too for the kidneys to make sure the kidneys are running okay. That the diabetes hasn't affected the kidneys as well. And then we go over very strict foot care for patients with diabetes to make sure that because when we mentioned neuropathy, what happens at if you have diabetes for a long time, you lose feeling in your feet. So we recommend people not to go barefoot, even in your own home, or to have slippers with nice thick soles on them, so that you don't step on something and hurt.
You wouldn't even feel it, right?
Right. And to inspect your feet, it's like the feet are way down below. I know even myself, after I kind of ignore them sometimes when I'm putting my my lotion on, like, oh, the feet, but the feet are so important. So it's important to inspect them every day, to look at them and look between the toes and make sure. Because when the blood sugars are high, you can get fungus infections. Athlete's foot is the other name for
So
it.
high sugar will lead to, is one of the
Yes.
causes of that.
Yes.
I wondered about that.
Yeah. Yeah, women can have like some yeast infections down below, or
Again, from high sugar?
high sugars, yes. So that's what brings them to the
Contributes to
doctors
it.
usually. That's when we find out they have diabetes. They'll have some problems.
And I know there are a
with
lot of diabetic elders that have to have the podiatrist to clip their toenails because
Yes.
infection is dangerous.
it.
Right?
Exactly, yes.
Yeah.
And I recommend when their toenails are very thick to not do not try to cut them yourself, because one little cut with the feet can lead to very big problems. So I recommend for podiatry or the foot doctor to really, they have the right tools to handle the cutting the nails.
All right.
Yeah.
Well, we're fortunate today that there are so many different items out here to help us, and diabetic shoes and all kinds of different things to help us, because the name of the game is to stay upright. We definitely want to be able to use our little feet to get around with. Well, do you have anything else to add, so we can go over to? Do you have anything else?
Yeah, I just want
clinically?
people to know that we have a CDE, the Certified Diabetes Educators. We have many of them, quite a few of us at Cambridge Health Alliance. So we work as a team with the nutritionists, and we have pharmacology who are also CDEs, and myself as a nurse. And we work as a team with the doctor and the nutritionist. We all work together to take good care of your diabetes. But of course, it's your disease if you have diabetes, and we ask that you do your check your blood sugars, and have to do a little homework on your part too.
Exactly. If we do not take care of ourselves, who is going to?
Yeah.